Well, good morning. I am so excited to be here today. I've been part of this conference, I think every year except for one, and I think I might have been pregnant with my firstborn and just wasn't feeling up to traveling. But I'm so excited to be here. I've talked a few times about exercise as well as the urban polling, and I'm excited to put all of it together here. I was asked this morning about whether I have a family member who has had Parkinson's disease. And no, I haven't. How I got involved was about 11 years ago when I was working at a physiotherapy clinic in Regina. My employer came to me saying that they were looking for a new individual to teach the exercise class in Regina. And it just so happened that I was like, yes, I get more hours of work, I get paid more, and I get to do, experience a whole new area that I haven't tapped into yet. And it was kind of, I found this niche, this group of individuals that just kind of took me in as part of their family. And kind of from there, it's built upon. And our exercise class in Regina, I don't teach it anymore, but I still manage it. It's been running for 11 years. And depending on the day, we'll have between 12 up to 22 people in every class. So it's very exciting that it's continued on. And we have a wonderful instructor, and her name is Anna. And she has gone through kind of a lot of the exercises that we're going to go over today, and she incorporates them into our program. So it's been a very exciting ride, and I'm excited to be here as well. So we're going to touch on just a few slides here. I'm also going to apologize for two things. I have a 9-month-old baby and a 3-year-old. So any of you moms out there will know that sometimes you get mom brain. So if I have a little bit of a brain fart, that's going to be attributed to mom brain. And then also, we've been battling this cold at home as well. The kids have been on antibiotics. It's been about 5 weeks. So I'm going to try not to cough too much. So just bear with me. And I also have this fancy remote here. Okay, so just wanted to touch, before we got too far into things, on the natural aging process. So as we age, everyone's going to go through these changes. We're going to see a decrease in our maximal aerobic capacity, a decrease in our bone mineral density, decrease in our flexibility, muscle mass, strength, and endurance. It's also interesting to note that approximately 25% of our muscular strength, 25% of our muscle mass will decrease between the ages of 30 to 70. We'll also experience a significant decrease in our muscular strength, again to that decrease in muscle mass, but also to a loss of mechanical or contractile properties or muscle fibers, and also a decrease in the activation of the motor units or the nerve being able to activate those muscles. One thing that I forgot to mention, in your folder, in your bag, there should be this handout. You can follow along with the presentation and make any notes throughout if you'd like. So I'll give everyone just a moment to grab that. Oh, that was really good. We'll maybe do that. Okay, I'll just carry on here. So looking at our next slide here, this is an MRI image of a cross-section of a 25-year-old and a 65-year-old's thigh. So that was if I would have taken my quadricep and I was to cut it right in half. So the dark area is muscle, and then the white area is fat. So as you can see in the 25-year-old muscle tissue, that there's a lot more white throughout the muscle. So there's more fat and less muscle fibers compared to that of the 25-year-old. So this is the replacement of muscle fibers with fat, which is called sarcopenia. And this is just, again, a natural aging process that regardless of chronic disease or disability, that will occur in all of us. Taking a look at how an inactive lifestyle affects us, research has shown that sedentary lifestyles can lead to premature death and increased incidence of chronic disease and disability, which places a strain not only on the inactive individual, but also on our healthcare system in indirect and direct costs. For those leading an inactive lifestyle, research has shown that they have a lower quality of life, loss of functional independence or ability, depression, mood disorders, as well as decreased longevity. Did everyone like my couch potato? Did you guys get that? Looking now specifically at Parkinson's and aging, research has shown that individuals with Parkinson's are more vulnerable to adopting a less physically active lifestyle following their diagnosis. Research has also shown that the combination of natural aging and disease-specific degeneration and disuse is often evident by a measured decrease in muscular strength and postural stability, leading to a decrease in functional capacity or ability, and also increasing the likelihood of falls. Research has shown that as Parkinson's progresses, so does disability, and independence decreases. Taking a look here just quickly at some of the symptoms that could affect an individual's ability to exercise. So these are things that may even prevent someone from actually getting to an exercise program, or even prevent you from getting to start the exercises, or while doing your exercises may impair your ability to do them. The first is bradykinesia, which is the slower and smaller movements that might feel like weakness, but instead it's the difficulty in starting and maintaining a movement, such as a repetitive task like buttoning up your shirt. Also handwriting, this may cause as well to walk at a slower speed, and the loss of facial expression. A tremor can affect the hand, foot, or jaw, and can also be intensified by stress, anxiety, or fatigue. So if you haven't had a good night's sleep and you're feeling tired and you're stressing about going to your exercise program for the day, that tremor could be acted up a little bit more than usual. Stiffness or rigidity refers to the lack of flexibility in the muscles in the arms, legs, trunk, or neck. In Parkinson's disease, the flexor muscles tend to take over, causing lots of tightness, more so than the extensor muscles. So the flexor muscles come really strong and tight, the extensor muscles become really loose and weak. Looking at balance problems as well, this can be caused by rigidity, because with those tight flexor muscles, what happens here is our posture changes. So as soon as our posture changes, that can cause a movement of our center of balance from between the feet to out in front, then decreasing the individual's ability to maintain their balance or stability. Freezing as well can be an issue, as it feels like the feet are glued to the floor when trying to walk. Looking now just at the non-motor symptoms, sleep. As I mentioned before, if you've had a crummy sleep, you're probably not going to feel up to going to exercise. Sensory motor integration, taking information from the environment and processing it and knowing what to do with it, can sometimes be impaired. Cognitive function, emotional impairment, weakness, as well as constipation can all affect one's ability to exercise. So what is the most effective way to prevent these changes or to recover from changes that have already occurred? Parkinson's, sorry, trying not to cough in the mic. Parkinson's specific exercise. People with Parkinson's disease can improve and maintain their improvements with exercise. This has been shown by research. So the first point here, exercise is a physiological tool that promotes brain health, repair, adaptation, and behavioral recovery from the inside. Recent research suggests that exercise may slow, halt, or reverse the progression of Parkinson's through two mechanisms. The first is neuroprotection, mechanism of the central nervous system to prevent neurodysfunction from occurring. The second is neuroplasticity, which is the ability of the nervous system to develop new neural connections. Taking just a quick look here on research on exercise specifically for individuals with Parkinson's. Inactivity has been shown to be pro-degeneration or weakening of the body. People with Parkinson's who exercise do fare better over time than those who are not active, and timing does matter. It's better to have an early intervention than a late intervention. Physical activity should be integrated early in the diagnosis and be a lifelong commitment. But I really want to make sure that I highlight it is never too late to start. Never too late. Engaging in aerobic activity along with other activities for strength, flexibility, and balance improves Parkinson's symptoms and sense of well-being. While exercising, you want to continually increase the challenge or difficulty of your exercise program. What you put into it is what you're going to get out of it. You want to make sure that you're always going to push yourself above that threshold. An example is if I was to do 10 squats today, and then I do 10 squats once a day, every day for this whole year. So I can still do 10 squats, but I'm not going to be improving my muscular strength, muscular endurance by doing 10 squats. So maybe for 1 week, I do 10 squats every day. The next week, I do 12, and I progress every single week. And within a year, I'll be able to do way more squats, and I'll have way more muscular strength and endurance in those muscles than if I was just to continue on with the same number of repetitions for that exercise. Parkinsons Canada, in partnership with the Canadian Neurological Science Federation, published the Canadian Guidelines on Parkinson's disease in July of 2012. 84 recommendations for family physicians, neurologists, and other health other healthcare professionals were developed to enhance the care for individuals with Parkinson's throughout Canada. For more information, if you'd like to, I think I included that link in my handout, but if you just go to parkinsonsclinicalguidelines.ca, you can take a look at that information. So looking at the recommendations for physiotherapists, exercise therapists, and occupational therapists, they want us to focus on flexibility, improved balance, gait training and walking, improvement of movement initiation, improvement of functional independence, and professional advice regarding safety in the home environment. Now, the reason why I highlighted number 6 in blue is because the only professionals that should be helping you with moving things around in your home to make it more ergonomical or safe is an occupational therapist. So I will not be speaking to that point, but over the presentation, we're going to be covering the rest of the points here. So first, looking at flexibility. In Parkinson's disease, muscles do not properly relax when you're at rest, decreasing your flexibility, causing the rigidity. This is one of the main symptoms of individuals. Onset is usually shown by aching muscles, muscle stiffness, as well as muscle weakness. Rigidity tends to be predominant in the flexor muscles, as I mentioned before, specifically in the rectus abdominis, which is your abdominal muscles, so you get that forward flexion through the trunk. Also through the front of the shoulder or in your anterior deltoid muscles, which causes rounding, as well as through the pectoral muscles, the hip flexors, and the calf muscles. So as you can see, that takes me into a little bit of that forward flex position, and as I mentioned before, this can move our center of alignment for balance and stability, making it a little bit more challenging. Twisting and rotation diminishes naturally as we age, and Parkinson's magnifies this problem, making it difficult to reach, to buckle our seatbelt, and to shoulder check. So with a decrease in flexibility, this leads to altered movement, difficulty initiating and completing movements, decrease in range of motion, problems with twisting and rotation, joint pain, as well as the Vulture posture. So this is another one. Does everyone like my Vulture? So we kind of lose our necks here, and we take on this type of posture as well. Looking at the second guideline or recommendation is to improve balance. Balance and stability issues range from mild to severe. Balance and stability issues are caused by the decrease in the reflexes due to dying nerve cells in the balance control centers of the brain. While performing any exercise, including your balance exercise, you want to challenge yourself and work really hard at these so that when you're out in the environment, when you're faced with stepping over something like the cord for the PowerPoint presentation or the TVs, you're feeling confident in it because you worked really hard in your exercise program and you challenged yourself. Balance is important for individuals' ability to walk, pivot, boost confidence, navigate through crowds, decrease their chances of falls as well. Looking at the third recommendation of gait retraining and walking. Walking is the most important activity that an individual can do. It allows you to move across the face of the earth, it keeps you from being disabled, and maintains your independence. The Parkinson's typical gait is a decreased foot speed, decreased foot clearance, decreased stride length, lack of arm swing, flat-footed or a toe-heel type of movement pattern instead of a heel-toe pattern. Improving the gait will help with walking speed, stride length, ground clearance, balance, and stamina, as well as delay reliance on assistive walking devices. It will also help with everyday activities like keeping up to your loved ones when going to a store to maybe pick up some groceries or going to the mall. The fourth recommendation of improvement of movement information, movement initiation, the first thing that comes to mind often is freezing, which is a problem that many have. It can cause anxiety levels to go up, which then the anxiety makes it harder to move. So the harder you try to move, sometimes the harder it is to move. It can be characterized by difficulty starting the movement or also a sudden stopping of steps. This can be triggered by the anxiety of fear, visual distractions, crowded environments, narrow doorways or pathways. Other movements affected include facial expression, softening of voice or slowed speech, not being able to stand up straight or maintain a proper posture, moving slowly or taking longer to finish certain tasks. Exercises improving movement initiation will help combat freezing episodes, stimulate and strengthen muscles responsible for facial expressions, speech, and improve activation and speed of movement. And last recommendation that we're going to cover today is the improvement of functional independence. To have functional independence, we need to have whole body muscular strength, endurance, and flexibility. Weakness contributes to this decreased ability to perform functional movements, so we want to make sure that we focus on the large power movements groups that will help correct posture or the alignment of the body. So we want to focus on strengthening the triceps, which are the back of the arm, the scapular retractors or your shoulder blade muscles, the spine extensors or the muscles that help to bring your trunk up into an extended position, your glutes or your bum muscles, your quadricep muscles, which is the front part of the thigh, and also our calf muscles. By increasing the strength and endurance in these muscles, we will be able to improve our posture, increase muscle force production, improve ability to stand and walk, and also minimize muscle fatigue. So just looking at a few exercise tips before you get started. Before starting any type of new program, it's very important to receive medical clearance from your doctor. So for myself as a certified exercise physiologist, we're required to have all of our exercise participants fill out a PAR-Q, which is a physical activity readiness questionnaire. What this does is it asks pertinent questions just about your health to indicate whether you may require, this is more so for a general population to determine if they require any medical clearance prior to taking part in an exercise program. So anytime that you're going to start something new, it's important to make sure you check with your doctor just in case there is a medication that the exercise instructor should be aware of, or maybe that Parkinson's disease isn't the only chronic condition. There could be a heart condition, there could be osteoporosis, osteoarthritis. There could be a number of different things that the individual that you're going to be exercising with should be aware of. Always remember to do a warm-up and cool down. Start slowly. Exercise in a safe location. Make sure you're breathing while performing the exercises. Exercise with a partner. It's always better to exercise with someone because you're able to talk to them, and sometimes you realize that your hour of exercise or 20 minutes of exercise has gone by. With the urban poles, what I tell a lot of my clients, if you go for a pole walk, you're walking with a friend, you're talking, so not only are you working your whole body with your poles, but you're also working your facial muscles because you're talking, you're chatting, you're laughing, maybe you're complaining, so you're frowning, but there's also other ways to activate the other muscles in the body, so working out with a friend is a great way. And we also want to set goals. If we don't have goals, sometimes it's easy to fall off and stop exercising, but if you set a goal that by this point I want to be able to walk for 30 minutes, no problems, no rest breaks, then that's going to help to keep you motivated while you're exercising. Looking here just at when you are exercising, how to go about it. So I spoke briefly about if I was to do 10 squats every day for a year, I'll be able to do 10 squats, but that's not going to be increasing my muscular strength or endurance. So this is kind of a chart that I draw up a lot of times for my classes in Estevan. So a lot of times we'll start with 3 sets of 6 repetitions. For someone who's brand new to my exercise program, this is where we start. So let's continue with the squats. Once they find 3 sets of 6, squats is easy, then we want them to progress to 3 sets of 8. Once that's easy, we want to do 3 sets of 10, 3 sets of 12, 3 sets of 15. Once that is easy, we don't want to just stay there because then we're not going to continue to push ourselves past our threshold. We want to go back to the very beginning by either adding resistance or increasing the exercise difficulty. So if I was doing just mini squats throughout my exercise program and I'm doing 3 sets of 15 and this is feeling great, no problem, one way to increase the difficulty is I'm going to go into a deeper squat. So I'm starting at 3 sets of 6 of doing a deeper squat. Another way that I could do it is then holding onto a 5-pound dumbbell. So I'm still doing my mini squats, but I added in a 5-pound dumbbell. So that's going to increase the difficulty of my exercise program. But then we always want to make sure that we go back to our 3 sets of 6, then we progress to 3 sets of 8, 3 sets of 10, and so on. The other thing that I talk about with a lot of my clients with as well is the line. Which side are you on today? And this kind of goes along with your symptoms on how you're feeling. Did you have a good night's sleep? Is your medication working properly today? So what you kind of have to decide is, here's my line. Today, I'm going to work on the side of my line where I'm going and doing my exercise program. My goal is just to get there. I want to get there, I want to get all my exercises in, and then I'm going home. The other side of the line is where you can push yourself past your threshold. I can take myself a little bit further, a little bit harder. Today is a really good day, so I'm going to push a little bit harder. So every single day when you go to your exercise program or you set yourself up at home just to do maybe your yoga or Tai Chi or whatever, you need to decide what side of that line you are on. Because when you're on that side of, you know what, I didn't have a good sleep, my medication isn't working well, pushing yourself might not be the best idea on that day, and making sure that you're recognizing where you are with that line. I wanted to include this just for anyone who's doing an exercise program at home. This is just a very generic phase of exercise session. You always want to do a warm-up. Then from there you can go into your gait retraining and walking exercises. You can go into your flexibility exercises, balance, functional movements, and then a cool down. So timelines can vary there. The only thing that I would never change is your warm-up and cool down. You want your warm-up to be 3 to 5 minutes. That way you get the blood flowing, you get everything circulating, you get the muscles warmed up, and also a cool down, which is very important as well, to make sure that you stretch out those muscles, you bring your heart rate back down. So we're going to go over in like an hour-long presentation. I know an hour is a long time, but really an hour isn't that long to talk about exercise. The next 6 points here on the next 2 slides, these are slides from Dr. Becky Farley. For those of you who may have been here, I think she was here 4 years ago. And it just talks about just the different functional movements that we want to do in an exercise-specific program for individuals with Parkinson's. So what we're going to do, because there's only so many points that I get to cover, because I also don't want to overwhelm everybody, we're going to do her points as part of our warm-up today. So we're just going to speak about this, and then we're going to get into some exercise and moving. So the first is voice. When you're doing your exercise program, whether it's just your warm-up or throughout the whole program, you want to try and incorporate your voice. It's going to help strengthen up the muscles, which is going to aid you when you're out and about with your family and loved ones, trying to talk to them in a busy restaurant so people can hear you, or talking on the phone as well. We're going to warm up our hands. Exercises for the hands are important as well, because it's going to help with eating with utensils, signing your name, getting out your wallet from your pocket, using your phone, or also doing up buttons. Exercises for reaching are important as well, because they're going to help to strengthen muscles that will aid you when catching yourself from a fall. Helping you to support your body weight for transfers, as well as improving your posture. Looking at rocking and weight shifting, these type of movements or exercises are important as well, because it's going to help when moving in the bed or on the couch, preparing to turn, rising from a chair, reaching for objects. Twisting is important as well. Who has problems when you're driving trying to do that shoulder check? Depending on how I've slept at night, if I've had a baby laying on me, my one side, I can't really get over there. So doing twisting exercises are important for different functional things throughout our day, like checking your blind spot in the car, getting out of bed, getting off the floor, as well as dressing ourselves. And also exercises that promote uptight motion or extension are good for getting out of a chair, out of bed, off the floor, reaching for objects on high shelves or up in cabinets. So now, I just thought I'd put one kind of funny slide in here before you guys start moving a little bit. This is a gentleman, and it says that it's your gym instructor calling, saying that flying to Tahiti wasn't what he meant by doing a warm-up. So we're going to get warmed up. I'm going to give everyone just a moment. I'd like you just to move your chair, so that I know that we're a little tight, but there are a couple of seats at the front here, just so that maybe if you put your elbows out to the side, you're not touching the person beside you. For all these exercises, I'm going to try and do the demonstration in seated or standing. If there's anyone who would like to go into standing and feel comfortable that they'd be able to remain in standing for the whole duration, so for about 30 minutes, you can head to the back of the room as well. You can, there's a few chairs as well at the back if you'd like to grab a chair, but we'll just give everyone a moment here. I haven't deafened everybody again with a cough in the microphone. So before we get started, I want everyone to, whether you're seated or standing, take in 2 nice big deep breaths. Doesn't that just feel better already? Okay, we're gonna start off with just a little bit of a warm up. So either in standing or seated, you can do the exercises. We're just gonna march on the spot. So even in seated, you can take it, be on your chair, moving your feet, and we're gonna open and close the hands. And we're gonna do 10 of these together. And I would like to hear you guys count with me. I don't wanna be the only one, okay? So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now from here, we're going to touch our thumb to each finger. Okay. And as we're going here, we're just going to count up to 10 again. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. We're going to go into some shoulder rolls now. So if you can keep those feet going, you can keep marching, nice big shoulder rolls. Anyone feeling some popping and cracking in there? A little grinding maybe, those good old shoulders. Let's go the other way, and we're going to count out 10 here again. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're just going to plant our feet here. We're going to bring our hands out in front of the body. So again, you can do this in seated or standing. And we're just going to turn side to side. This time we're going to count up to 12. So let's go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Hands on your sides now. In the chair, you can just be seated and just bending, and we're going to do some lateral bends here. So I'll move up just so everyone can see me. So if you're in standing, just bending side to side. Comfortable range. And we'll just count to 5 here. 1, 2, 3, 4, 5. Excellent. From here, we're going to do just some little mini squats. So they don't have to be very big, just really teeny tiny little ones. In seated, you can do knee extensions. So you're alternating, kicking your legs up. So in seated, alternating kicking legs up. In standing, and we'll do 5 more squats together. So we'll go 1, 2, 3, 4, 5. Now seated or standing heel lift. So just lifting our heels up nice and high off the ground. And we'll go for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And one more movement here, whether seated or standing, we're going to reach up and across. So if you're in standing, try and turn your hips, picking a speed that you're comfortable with. In seated, doing the same thing. You can reach up above shoulder height, or you can also reach at shoulder height. Whatever is comfortable. And let's do 5 more. Let's go 1, 2, 3, 4, 5. Excellent. Let's take in 2 nice big deep breaths again. Okay, excellent. Now that we're warmed up, I would like everyone just to have a seat in your chair. And I have to, if I forget to click the slide, make sure you let me know. So for all 5 points, I have 3 exercises. So I don't want to overwhelm everybody because I could have given you lots and lots and lots, but I try to really keep it honed back. My mom is always, I run all my presentations by my mom, so she's like, no, you're doing too much. So hopefully this is enough, but not too much. So as I talked about at the beginning, our chest muscles are one of our flexor muscles, and they become very, very tight. So we're going to do just a few, we're going to try out a few of these chest stretches. In the handout, it says to do these stretches 2 to 3 times, holding for 20 to 30 seconds. So the first one is one of my students from a long time ago. He's sitting with his back on the chair. Now just be careful because these chairs rock a little bit, so lean all the way back first. And then you can bring those arms up and just reach back. Taking in nice big inhales and exhales, not holding your breath. and let's just come on up. How did that feel for everybody? Okay? The second one that we're gonna do, you can do this one in standing or seated. You may need to slide your bum to the front of your chair, taking your hands back behind you. I'm just gonna stand up so everyone can see. If you'd like to stand up to join me, you can. You're gonna open up across your collarbones first, and then lift the arms up. So opening up across the collarbone, so keep your arms relaxed. If we lift here, we're not gonna get our pecs. So you wanna roll the shoulder blades down and back and then lift the arms. Now, depending on where you're tight here, you may feel a stretch in your forearms. You may feel it in your biceps. You may feel it in the front of the shoulder, or you may feel it across the front of the chest. Does everyone feel a stretch in there? Okay, and we'll relax the arms, shake them out. Everyone can have a seat again. This is you guys are definitely getting your exercise today because it's lots of up and down. So the last one here is Krista, just in the corner. She's wearing the orange scarf. So in the first picture, sorry, she is standing in a doorway with her arms up in like a T position or a W position. So just seated, you can bring your arms up in this position and then just try and bring them back. Now, you can do this one in the doorway. So with your forearms on the door frame, and then you can lean forward into it. This is going to really help to open up across those muscles. So even in seated, you can try and push forward. Now, this is a good stretch, but you can also take it to the second picture that she's in and do one arm at a time. So again, you're placing that forearm on the door frame, and then you're going to turn away from it. So this is one that's good for you to try at home. Make sure that no one's going to come by and shut the door on you if you're standing there. Remember, exercising in a safe environment, you don't want to get slammed by the door. So that is our chest stretch. 3 different options for performing those ones. Next, we have our Piriformis, or our bum stretch, Jennifer. She took a look at my PowerPoint presentation and said, what is a piriformis? But piriformis is one of your muscles that runs down the back of the hip. This is a very tight muscle, generally in a lot of individuals. So I'm going to have everyone slide to the front of your chair. Once you're sitting up nice and tall, you're going to cross, first of all, if you have had a hip replacement in this room, you have to be careful because this can take your knee past a 90-degree bend, and that could put you at risk for a dislocation. So if you've had a hip replacement, what I recommend doing here is extending your legs out and just crossing your ankles over, okay? If you have not had a hip replacement, cross the ankle over the knee, sitting up nice and tall, and then you're going to try and stick your nose out over top of the knee. With your hip replacement, you can have that leg kind of anywhere on that lower thigh and just bending forward here. You may find that you still get a stretch. Does everyone get a good stretch here? You all have a tight butt. Let's come on up. We'll switch legs. We'll do the same thing on the other side, grabbing onto the ankle, applying pressure onto the knee, sitting up nice and tall, and bending forward. Anytime you're doing stretches, you want to take in nice big inhales and exhales. On your inhale, you're static or not moving. On your exhale, you want to lean a little bit further into it. We're going to switch legs back to the first leg. So a variation off of this is pulling the knee up and across to the opposite shoulder. So give that a try. This will align your muscle fibers a little bit different. We'll target the hip a little bit different for where you're getting a stretch. I find that I get it closer to my sit bone or the bone in my bum. So it moves it just a little bit. Let's try it on the other side. Cross the ankle over, pull the knee up and across. Is everyone feeling okay here? No one's getting too much pain in that hip? Does anyone have a difference from one side to the other here? Yeah, a little bit, okay. We're gonna go to the last one here. All of these exercises are in your handout. The last one is from the Delay the Disease group out of Ohio. Is the seated rotation. So we're going to do the second picture there where it has a number 2 on the bottom. So you're going to cross the ankle over. So whichever knee is up, you're going to turn to that knee. So this is going to give you some stretch through your trunk, through those rotation muscles that not only tighten naturally as our age, but get tighter in individuals with Parkinson's disease. So again, big inhales and exhales here. On your exhale, try and turn into that rotation a little bit more. Inhale your static, exhale your turn. Let's switch legs. So same thing on the other side. Whatever leg comes up, you're turning that direction. And again, for my hip replacement people, you can cross that ankle over. So same thing, whatever knee is up a little bit higher, you're going to turn that way. Taking nice big inhales and exhales. Okay, and everyone can relax and just place both feet on the floor. This is an easy one. Who watches TV in here? This stretch 3 times on each side, easy peasy while you're sitting on the couch or in your comfy chair watching TV. The next one that we're going to look at is our child's pose stretch. I put just a caution on this one as well for if you've had a hip replacement, going down onto the floor and doing this stretch probably isn't the best idea. Also, for Jared, you can see he's bent forward here at the hips as well. If you've had a hip replacement, not the best idea to go that far into forward flexion. Also, if you have any issues bending forward and losing, getting dizzy or feeling faint, don't drop your head all the way down. We don't want anyone to be passing out during these exercises going, well, Jessica said. No, don't do that. If you know of a reason why you shouldn't do an exercise, please don't do it. So again, we have 3 options here for doing the exercise. We're going to do the seated version, and then I'm also going to go over the standing version. I just want everyone to watch me here. I'm going to be sitting at the front of my chair. I'm going to take in a deep breath, and then I'm going to let my hands drop down to the floor. So if you are one of those individuals who does have any issues with dizziness or lightheadedness, what you can do is take your elbows, place them on your knees, and take in nice big deep breaths. So if you'd like to give this one a try, nice big deep breath in, dropping hands either down to the floor or elbows to knees, and nice big inhales and exhales. Okay, we're going to do it one more time. We're going to hold for 2 breaths. So nice big deep breath in, coming forward, hands to the floor or elbows to knees, big inhale and exhale. One more, big inhale and exhale, and slowly come back up. We're going to come and stand behind our chair. If you feel comfortable standing behind your chair, please do so. If you do not, you can stay seated and maybe try the child's pose stretch one more time. In seated. So the standing version, as you can see in the bottom corner, she's using a wall, but you can take your hands, place them on the chair, walk your feet back a little bit, take in a nice big deep breath again, and then drop the trunk down towards the floor. Big inhales and exhales here, not holding your breath. You can play around here with your knees. You can bend your knees into a deep bend. You can straighten one leg and have the other leg bent, and vice versa. Let's slowly come back up, and we're going to take in 2 nice big deep breaths as a group. How did that feel for everybody? That really helps to give a nice stretch all the way down the back of the legs, maybe into the hips and into the trunk. Did anyone feel a stretch in their armpits at all? A little bit? Okay, we're going to do that one more time. Make sure that you're breathing as you're doing this one. Hands are on your chair. Take your feet back. Drop your head down. Big inhales and exhales. Maybe you're bending your knees. Maybe you have your legs nice and straight. Maybe you have one leg bent and the other straight, and vice versa. And slowly come back up into standing. Take in 2 nice big deep breaths because we tend to hold our breath when we exercise. Excellent. Everyone can have a seat on their chair. And maybe again, once we're seated, I'd like everyone to take in 2 nice big deep breaths again. Okay, we're going to move on to our second recommendation here of improving our balance. So improving our balance, as I said, is important. We're going to start off with heel-toe walking. Sorry, There we go. So this again is from the Delay the Disease group. I'm going to show you my book from the Delay the Disease. I've used it so much that my cover is no longer attached. So I really like this resource. It's the print in it and the pictures are very straightforward, very easy to understand. So I use this with a lot of my clients. So for the heel-toe walking, we can either do it in a stationary, which we're going to do today, or you can do it as a fluent type of walking. So in seated, what you can do is have one foot out in front of the other and one foot behind. So your feet are staggered just like if you were naturally walking. And you can just sit here in your chair and rock back and forth. So you're going to start with your heels on the ground, then you're going to lift your heels as you roll the weight onto the ball of the foot. And you're just rocking back and forth here. And then we're going to do the same thing with the other foot. So we can rock, and you know what? We haven't counted for a while. So I want to hear you guys nice and loud. We're going to count to 5. Let's go. 1, 2, 3, 4, 5. So this mimics our natural walking. As I mentioned before, with Parkinson's, sometimes the walking becomes flat-footed, or instead of having your heel come in contact with the floor and transferring the weight onto the ball of the foot to push off, you actually reverse it where you're hitting the ground with the ball of the foot and then rolling onto the heel. So if you feel comfortable of going back into standing, we're getting our sit-to-stands in today. I'll get everyone who feels comfortable standing behind your chair. If you'd prefer to stay seated, you can continue on with the same movement that we started with, so one foot out in front, one foot behind. And we can try the same thing in standing. So you're holding onto your chair or standing free if you don't need any support with balance, and we're just rocking back and forth. So rocking from the weight from onto our heel, and then our back foot, it's almost like you're pushing off, like you're gonna start walking, like you're gonna explode going forward. Let's switch legs, we'll do the same thing on the other side. So just rocking, we're working on transferring our weight, transferring our center of gravity. Excellent. So if we weren't here, what I would probably have you guys do, most likely with your poles, is I'd have you walk, taking that nice and slow, working on transferring your weight, having your heel come in contact with the floor, and rolling onto the ball of the foot. So when we break next, I'm going to be watching everybody walk to go and get your lunch to see if you're walking heel to toe, nice and slow. The next one that we're going to talk about is our Tandem Balance. So this one we can do in standing, so if you're comfortable staying standing, you can do so, or if you'd like to take a break and go into seated, we can do this one in seated as well. Our Tandem Balance, we can do a few variations. Traditionally, it's with the foot directly out in front of the other. If you do not feel comfortable here, you can have, instead of having the feet directly aligned, you can have the front foot out to the side a little bit, and you can have the front foot back a little bit as well. So whatever you feel comfortable with, whether that's directly, your feet are in front, or one foot out to the side, or back a little bit. So as we're standing here, we want to check, make sure that our weight is evenly distributed in both feet. It's really easy for me to stand here, hanging out with all the weight in my back foot. Then as soon as I try and transfer that weight evenly into both feet, making sure the front foot is in contact with the ground as well as the back foot, this is what my feet start doing. They're working a little bit. How's it going in heels over there? A little. So if you feel comfortable in standing or doing this exact same thing in seated, let's count to 5. Just standing nice and tall or sitting nice and tall with your back away from the back support of the chair. And we'll hold for 1, 2, 3, 4, 5, and we'll switch legs. So other leg out in front. So again, those people who are seated, sitting with your back on the chair is going to make it really easy. So I want you to sit up nice and tall. In standing, we have ears over shoulders, shoulders over hips, hips over feet. We're going to hold for 5. 1, 2, 3, 4, 5. How did that feel? Did anyone feel their toes gripping in their shoes? Don't do that. Try and keep your toes nice and relaxed. We're going to do one more exercise for our balance. Again, if you're comfortable staying in standing, you can stay. If you'd like to have a seat, you can. This is our driver lunge with balance. So I'm going to demonstrate, actually I'm going to maybe have everyone just take a quick seat just while I demonstrate for those who are seated so they can see. So if doing all of your exercises in standing isn't a good option, we can easily take this one into seated. So you're sitting at the front of your chair. As I mentioned, sitting like this, really slouched in your chair, your core doesn't have to work. Okay, so we want to try and sit up nice and tall. Our sit bones or our bum bones are at the front of the chair. So what we do here is we will take a step forward with one foot, and then we're going to drive that arm up. So step forward with the one foot, and we're going to just stay on the same side, so we're not alternating. Same arm, same leg. Now, I'm looking forward. This exercise is going to be easier because I'm picking a spot that I can balance on. Now, to make this a little bit more challenging, watch that hand. This is going to take away your visual cues for your balance. Going to make your proprioception or your awareness of where you are in space work a little bit harder. Let's do the same thing on the other side. So you can start by just looking forward. This is a great exercise that's working my core muscles as I'm leaning forward. I'm flexing a little bit at the hips. My arm is working. Now watch your hand. Does that change it at all for you? Takes away that easy visual cue of where you are. Okay, let's try this in standing for those of you who feel comfortable in standing. If you are staying in seated, you can do the same thing in seated. If you're not quite ready to do the exercise without holding onto the back of the chair, you can do this motion. What's motion? You can do this motion while holding onto the back of your chair. If you're feeling comfortable, you can just not use your chair for support. So here we start with our feet together. I'm going to take a step forward with my right foot, and then I'm going to bring my right arm up. And I'm just going back and forth. You can place a finger on your chair here just for a little bit of stability if needed. Watch your hand. Does that make it a little bit more challenging? Because you're moving everything here. Your head is moving, your arm is moving. Let's try it on the other side. Are you guys still hearing me okay as I'm talking? Okay, same thing on the other side. So I'm stepping forward, whatever foot I'm stepping with, my hand is moving. So I'm watching that hand. Excellent, that looks great. Now, was there a difference from one side of the body to the other for anybody? Yes? Okay, so what you can do with, let's say, our 3 sets of 6 of this exercise. On your stronger side, you can do 2 sets of 6. On your weaker side, you can do 3 sets of 6. So doing one more set on the weaker side to help strengthen it up so that it gets to be even or closer with your stronger side. Okay, everyone can have a seat on their chair. Let's take in 2 deep breaths as well. So we're going to look now at we got started a little bit late, so I'm going a little bit late, just so you guys know. We're going to go into our gait retraining. So we actually only have 2 exercises for this one because one of the points is urban polling, and I could talk about urban polling for like an hour and a half and the benefits for people with Parkinson's. But the first one here is seated or standing bicycle trunk. So we'll do this one just in seated. So again, we want to scooch to the front of our chair. So our bum, sit bones are right close to the front of the chair. From here, we're going to take our hands and just place our fingertips on our earlobes. So we're not pulling at our head. We just have fingertips on our earlobes. We're just going to start by turning at the trunk. So we're just turning side to side. If you get dizzy or lightheaded, don't turn your head, keep your eyes forward. If you'd like a little bit more of a challenge, you can turn your eyes with your rotation. Now, this is where the challenge comes in. We're going to bring the opposite elbow and opposite leg together, okay? So we're just going to go nice and slow, alternating. So right elbow to left knee, left elbow to right knee. This is a brain exercise as well. It makes the brain work to try and get everything working together. Excellent. Let's take in 2 nice big deep breaths. So I'll just give the demonstration of this exercise in standing. It can be here, it can be here. It can be taking the hand to the opposite knee. It can be just barely lifting your foot up off the floor. There's a number of different variations. You don't have to get that knee all the way up to that elbow. Whatever you're able to do is what I would like you to focus on. Okay, now moving on just to the activator pulls for Parkinson's. I know that I've talked about this before, and this might be a repeat for some of you. I am an urban polling master trainer, so I am the Saskatchewan ambassador, or the individual responsible for the province with the urban polls. The design features are our ergonomic handle. The owner of the company, Mandy, she is an occupational therapist, and she did her master's thesis on walking poles. So she took all the different types of walking poles and then took all the benefits from them and tried to develop our urban poles. So our activator pole is our rehab pole. As you can see, the handle here, it has this nice ledge, which allows you to hold the pole with your wrist in a neutral position. With other types of poles, there's straps on them, so you don't have this support, and that can cause the wrist to go into an extended or flexed position. So this helps to keep the wrist in a nice neutral position, as well as every time that I push down on this handle, my core muscles are going to engage and contract. So you're not only walking, you're working your upper extremity because you're using your arms, but you're also getting your core muscles engaging. Our new poles have a new design for the top of the handle, so that if your wrist gets fatigued or your hand gets fatigued in this position, you can also take your palm and place it onto the top of the pole. So I'm able to hold onto it this way and walk with my pole here, or I turn it and I'm able to walk with it this way. So it just changes the alignment, but it still helps to maintain that neutral position in the wrist. From there, we have a button locking system similar to that of the cane. So for these poles, you're able to put 200 pounds of pressure into each pole. So for anyone with balance and stability issues, these are a great tool to help you to lean into them to get that additional support while walking. We also have a nice big round bell boot tip. This helps to increase the amount of surface area that's covered when walking. Other poles, some of them have really skinny boot tips, or they're only about the same size as our carbide tip. So this nice big round boot tip helps to increase the surface area that comes in contact with the ground, thus increasing your balance and stability. So the benefits with the activator pole, there's 4 points of stability on the ground versus 2. There's bilateral support, or support in both arms. Mimics contralateral walking, or our natural walking. There's numerous neurological, you're activating 90% of the muscles in your body, and as I spoke about earlier, if you go for a walk with a friend, you're getting all these muscles working as well. It helps to create a visual cue, and it also helps to support arm and leg extension. What does the research about the activator poles say for Parkinson's? Studies on Parkinson's identify polling as a healthy mode of physical activity suited for improving quality of life. It's also shown to increase balance and stability, posture, core strength, walking tolerance, independence in activities, confidence, decrease stress, anxiety, as well as depression. So I use these poles quite a bit for gait retraining. So we can do like that heel-toe walking here. So for someone who maybe needs a little bit of assistance when you're doing your heel-toe walking, you can use the poles and lean on them. Even just in standing, I can use the poles just for a little bit of balance and support here, and I can just do some heel strikes. I can also go into a high knee. I can take that into a stationary marching, still getting a little bit of support, paying attention, am I using one pole more than the other? I can do a side step. I can tell you that my ladies in Estevan really hate this one, and I have no idea why, but they find it to be a really good challenge. Balance exercises as well. We can use it for our tandem balance. So one foot in front of the other, I can use my poles here to provide a little bit of assistance. In this picture, there's a gentleman named Bill. He was diagnosed with Parkinson's at the age of 49. He was an avid marathon runner, and he found that because of his tremor and some weakness, he wasn't able to continue on running as the long duration. So with incorporating the activator poles, he has now completed 23 half marathons and 1 full marathon. He found that it really helped to support his strength and also helped to decrease the tremor on the right side of his body. I'm not sure if you guys have heard about Harry, but he did 500 miles for Parkinson's and actually walked from New York to Toronto. And he was walking 24 kilometers per day, and about halfway through his walk, he started incorporating the activator poles. One of his therapists had recommended it, and I do have a video, but I was worried about it being too long. You can see in his walk without the poles, he had that forward posture and that little bit of forward lean. So he really wasn't walking in the best effective way to walk that distance every single day. Once he got the activator poles in his hands, he was able to bring his trunk into a more upright position and able to really extend the arms, get that arm swing going, and have a longer stride length as well. And this is just a testimonial from his occupational therapist that was part of his support team, that within minutes and with guidance, Harry integrated the use of his activator poles into his gait. His cadence was steady and coordinated. He was mobile, aligned, and stable. His risk of falls is diminished and his base of support has increased. His postural asymmetry is decreased, allowing him to increase visual field. I could go on. Harry was able to adapt readily and the positive outcomes were immediate. Does anyone want to walk from Toronto to New York? We can repeat this as like a study if you guys were interested. So here's just a slide here. This is Catrin Mackenzie. She is from Regina. And when I lived in Regina, I worked with Catrin for about 5 years, maybe a little bit longer. And she also has a smaller stride length as well with the poles. It really helps her to elongate her strides because she's able to use the support from those poles. So kind of that seeing is believing. We have a new program that actually was just developed by Deanna with Urban Polling in Toronto. Pole dancing for Parkinson's, which combines the benefits of movement exercise as well as meditation and music. So I'm sure as Fran probably spoke to this last night about how music is beneficial for individuals with Parkinson's, that it can stimulate dopamine and serotonin and help to promote movement with exercise. And meditation is also shown to release dopamine in locations of the brain where motor activity occurs. So by combining these 3 elements, we're developing a brand new exercise program that we will make available to all the support groups, those who are using the urban poles. And we just have a video here. Okay, so that's just a very quick look at how you can incorporate music, poles, and then also the meditation aspect. As I said, this is a brand new program that Urban Polling has, so I don't have all the information on it, but once I get it, I will make sure that I pass it along to the individuals at the office. I know we're getting a little bit close on time. Looking at number 4, the improvement of movement initiation. So the first one is relax your jaw and step. So this is from, again, the Delay the Disease group, and it might sound funny that when your jaw is relaxed, the rest of your body is relaxed. So if you have any issues with freezing, this is an excellent exercise for you. So what you want to do is just practice relaxing the jaw, taking a step back, and then going forward. And this is something that if you have a freezing episode that you can do, is Instead of trying to move right away, just take that second to relax, take a step back, or also a step to the side, and then go ahead. Replacing that motion that you're wanting to do with the relaxing of the jaw, and that backward step or that side step will help you to regain that motion to be able to do that movement that you were trying to complete in the first time. So all that information just about that one is in that handout there. Our next one here is stepping over an object. Does anyone have maybe a little bit of anxiety about going out with it being springtime and going for a walk, not quite sure what you're going to come across, whether it's sticks and twigs on the sidewalk or maybe a big puddle, a sidewalk that is kind of cracked like this where you have to take a big step? This exercise is going to be done in a controlled setting, controlled safe setting that you're practicing stepping over. So it doesn't have to actually be an object that you're practicing to step over. It could be something as easy as the riser here. There's a silver line. So I'm relaxed, I'm looking forward, I'm using my peripheral vision, and I'm going to take a nice big step over that object. And you can, with all the silver lines here with the risers, I could continue on. You can also use a sock, a toque, a scarf, anything that's not going to put you at any risk while performing this exercise, but just practicing this is going to help you when you come across things in your real life or in the real environment. And also we can use our poles here to provide that little bit of assistance with that step as well. So I have my poles and I'm using my peripheral vision to take that nice big step. I'm taking nice big ground clearance as I'm going. Going into our decreasing by numbers, we do this one quite a bit with my group in Estevan. We, at our rink, we have a nice beautiful concourse that has a walking track on it. So what we do is we set a starting spot and an ending spot. So let's say from right here to the end of the riser, I'm going to count how many steps I take. So I take 1, 2, 3, 4, 5. Now my goal here is to get back to the podium by taking one less step. So how do I do that? I do that by taking longer stride. So 1, 2, 3. Oh, look at that. I was able to decrease it by 2. So that is something else that you can work on. That's going to not only help improve your movement initiation, but also help with your gait and your walking. Picking a spot, if you're walking outside, you can pick, I'm going to start at this tree, and I'm going to walk to that tree. I'm going to take, if you take 10 steps there, then try and decrease that by 1. In Estevan, we use the sections for the seats. So from section A to section B, I have my group count. From section B to section C, they're just walking normal. The next section, they're trying to take less steps. Then they get a section off. Then they try and take less steps again. So it's kind of that you can give yourself that little bit of rest, but you're always trying to increase that stride length. That's also going to help to increase your balance and stability while walking. Going on to our last guideline here, functional independence. So we're going to go through and do these exercises here. Improvement by doing seated or standing chops. So we'll start by sitting in our chair. I want you to do what? Scoot your bums forward. So what we're going to start off is just bring your hands into the middle. You can hold on for resistance at home. Or in an exercise program, you can hold on to a water bottle, a dumbbell, a medicine ball. Take your hands to one knee, and then you're going to reach up and across. Hands to the outside of that same knee, and up and across. We'll do a few repetitions. Let's do 3. Let's go 1, 2, can't hear you, 3. Okay, we're going to go same other side, same thing. Let's go 1, 2, 3. Okay, we're going to stay on this side, but this time I want you to watch your hands as you go. So we'll slow it down just a little bit, and let's go 1, looking at your hands the whole way, 2, and 3. I'm going to get everyone just to look at me for a second. If I'm doing this action, so I'm doing it with my arms. My arms are getting a great workout here, but I'm looking forward. If I watch my hands, see what happens to my trunk. I turn. I get more rotation through my trunk. And this is going to help strengthen me. Here as well, you can go from a lower position to come up, or you can stay just at the height of the knee as well. The same thing can be done in standing. So I'm just starting here. I'm not bending my knees at all. If this is easy, you're able to do 3 sets of 15, you can add in a weight. Or you can also increase your depth for the exercise. You can go into a little mini squat and then come up. Little mini squat and then come up. You can even work yourself all the way down to where you tap the ground and come up. So again, a few variations, and I want to include both the seated and the standing version here. Snow angels. So we're going to do this seated in our chair, but when I give this one to my members of my group, we stand with our backs to the wall. We stand with our bum against the wall, shoulders against the wall, and head against the wall. What that forces is us into a proper alignment or posture. So I want everyone just sitting with your hands at your side, just checking to make sure that you're not going to whack the person beside you, unless they're maybe your spouse and they kind of aggravated you a little bit, or you're making a new friend. Okay, so you're sitting in your chair. I'm just going to stay standing so everyone can see me. Sit up nice and tall, roll your shoulder blades down and back, and we're going to try and make a snow angel. Trying to keep your arms back. So it's very easy for those arms to come forward. Try and keep those arms back as you come all the way up. And then try and keep them back as you go all the way down. So this is better to be done on the wall because your hands can follow the wall. As soon as your hands come away from the wall, that means that you're rounding through your chest, or maybe your head isn't in contact with the wall. The wall is your cues, and it's really going to help to open you up across your pec muscles, bicep, and forearm. And this is going to help to aid in better posture and alignment. How did that feel? And you want to try and keep those elbows nice and straight. So there's some room over here. If anyone would like to try their snow angels after my presentation. Jennifer, how does it feel on the wall? I will be doing sessions every 5 minutes for the snow angels on the wall over there. And then we have one last exercise, and I kind of view this one as one of our most important, our sit to stand. How many times? Oh. You can breathe in as you come up and then out as you go down. As long as it's a steady flow, because this isn't a strenuous exercise, as long as you're maintaining a steady flow of breath through it. So the question was how do you breathe? So it doesn't matter if for this one if you're breathing, inhaling or exhaling in a certain direction. So our last one here is going to be our sit to stand. So every single day we go from a seated to a standing position numerous times. We want to try to make sure that we're very strong in our big quadricep muscles, our big glute muscles, as well as our core muscles, because this is going to help us to maintain our functional independence. So we have 2 different exercises here. The first one is Krista performing it on the wall. And this exercise actually came from Nancy Edwards, who is a physiotherapist in Regina, who has worked with individuals with Parkinson's for over 30 years. I'm just going to give a quick demonstration here. So imagine that I have a wall in front of me. If I'm very tight through my pec muscles and my flexor muscles, I'm going to be sitting maybe a little bit more like this. What the wall does is it helps me to bring my hands up, and it forces my trunk into an extended position. So it takes me from this forward flex position where my center of gravity is maybe sitting behind my feet into an extended position. And then from there, I go up into a stand. So you can do that one at home, or even just with your hands like some of the participants are. You can do that way as well. If you need to use your arms, make sure you're using your arms. We want to make sure that we're always doing an exercise appropriate for our abilities. So if you feel like you're comfortable doing a sit to stand and would like to join me, you can. I want everyone to slide your feet back just a little bit. So you can have your hands up if you'd like, or you can have your hands on your hips. You can also have your hands on your chair. What we're going to do is we're going to shift our shoulders forward, and we're going to stand up, pushing through our feet using our big, powerful muscles. Now, your exercise is not done. You need to lower yourself in a slow, controlled manner. What we just did was a concentric exercise, so we activated our muscles, we shortened muscle fibers, but when we go down to sit, we're going to be working against gravity. So there's no bum plops, okay? So we don't want to do this. We don't want to just kind of sink into our chair. Make sure your chair is behind you. If you are on the laminate here, make sure your chair doesn't slide. So this is also important for fall prevention too. You're going to lower yourself down nice and slow. This is actually going to work your muscles harder than the standing up motion is this sitting down, slow and controlled against gravity. Okay, let's do one more just for good measure. So let's have everyone stand up and then nice and slow down. Excellent. You guys can relax. Last slide. For more information, here's my contact. My information is also on our handout. Thank you so much. I hope I didn't overwhelm you guys. I am always so happy to come and talk to you. And I guess we have a question period.
I've just heard from a few people today that it's not everybody that wants to go out to an exercise program. So I'm just wondering if you are trying to use your guidelines at home, is it quite important for the caregiver, care partner, to try to do the exercises with the person with Parkinson's?
If you're at home, it can be beneficial. So kind of that exercising with a partner, it makes you more accountable for what you're doing, because it's a lot easier when you're at home, you're all by yourself. Oh yeah, I'll start off with 3 sets of 10. Then it's like, well, maybe I'll do 1 set of 10. So it's good for that motivation and accountability, but also for posture and alignment, because although I think that I might be standing up really tall and really straight in my mind, this is how I'm actually standing or performing the exercise. I'm not, unless I have mirrors around me to see how I'm doing them, it is nice to have that feedback from someone who, and it doesn't have to be every time that you exercise together, maybe every second time or whatever, just to give that little bit of feedback, and also just that motivation to work out together.
Alan, just one second.
I don't have a question, but just want to make a comment. I inherited my husband's poles, and in the wintertime, you can take off the rubber thing, and given, I don't know what you call that, but given that pointy thing that's at the end of these poles, this past winter where we had so much ice, it, and snow too, obviously, but it made walking really, really helpful.
I don't really know how to word this, but do you find that when you're dealing with somebody trying to work them physically, that their mindset will help them or hurt them? And do you, in so finding that, because most people have more negative affirmations than positive affirmations, do you also do mental exercises to get them to think more positively so that they can now be more positively engaged physically?
There isn't anything specific, like a specific exercise that we do mentally to get that positive thoughts, or that I'm doing something good and I'm going to keep doing it and I'm going to really like it. What we do with our class in both Regina and Estevan is individuals are able to bring a caregiver or spouse, and there's no charge for that extra individual coming to class. So first of all, you're getting your partner or someone in your family is coming and exercising with you, so you're getting that encouragement. You're able to talk to them maybe in the car ride over. And then also what we do with that, it kind of develops almost like a little mini support group within our exercise class, because then the caregivers can kind of talk to each other about, this is what's going on in our household, is that what's going on? Or it can also be just a complete break from what's going on. And also the individuals with Parkinson's can discuss among themselves as well. And I just find that our exercise group, it just helps people to get out of their home, get them interacting with people, able to enjoy maybe a little bit of sunlight, and that is more the positive and uplifting. And then from there, we just have developed almost like a family mentality, and everyone kind of leans on each other for that little bit of support and that bring more positive into their life. Other than just my smiling face, that's about it.
We'll take one more question over here, and then just we'll be happy to answer your questions as well. So we're going to break for lunch.
I don't have a question, but I have something else. I occasionally do exercises at home, and if I can see myself in the mirror, then I can really tell what I'm doing. Because a lot of times you think you are standing straight, but you're actually slouched over. So when you see yourself in the mirror, the mirrors don't lie.
That's right. And that's why also for that snow angel exercise, with the description, it talks about making sure that your bum is on the wall, shoulders on the wall, and head is on the wall. Because if you're on the wall and it just said, make sure you have good alignment, you're going to just have your bum against the wall and you're going to be doing things all willy-nilly. So making sure that you're maybe doing exercises in front of the mirror or using things like a wall while you're doing different exercises to give you those cues or those triggers to make sure that you're doing things properly is very important. So thank you for bringing that up.
I did say one more question. Anybody has one more question for this before we go finish? Last call. All right, I think everybody's hungry. All right, so can we just thank Jessica again for